Is there any way to tell if you have lipedema? Well, lipedema is a fat metabolism disorder that affects mostly females, and frequently it's painful. It's a chronic condition that causes abnormal fat buildup, usually in the lower portion of the body. However, it can also affect the arms. There's no laboratory test to diagnose lipedema, so lipedema is a clinical diagnosis. So number one sign of lipedema is abnormal fat distribution. The legs affected by lipedema appear to be heavier and larger for the overall frame. Lipedema fat is frequently resistant to weight loss regimen, even to bariatric surgery or weight loss drugs. Lipedema fat distribution is usually symmetrical, so it affects both legs or both sides of the body pretty evenly. Lipedema fat is usually denser and more fibrous. I see that during my liposuction procedures all the time. It will appear that the fat in the lower portion of the body is very nodular, lumpy. Patients with lipedema will frequently have poor circulation in the area, so the area might feel cooler to touch. Another sign is easy tendency to bruise. Even with minor trauma, patients with lipedema usually develop significant bruising in the lower extremities. Also, in advanced case of lipedema, patients experience significant joint problems, joint pain. And the last thing I want to talk about is what's called Stammer's sign. If you can pinch the skin above your toes with your two fingers, that usually means the Stammer sign is negative, is consistent with lipedema. If the Stammer sign is positive, you cannot pinch the skin, and that's usually a sign of lymphedema, problem with the lymphatic channels.